Okay, so I'm going to get things kicked off today by talking about how I've kind of fused functional medicine with regenerative aesthetics. So we're going to go over the basics of what functional medicine is, regenerative aesthetics, some emerging topics in regenerative aesthetics, and how this really fits into longevity, well-being, and of course your practices. Who's familiar with functional medicine? Feel it? Okay. So I started studying naturopathic medicine over 20 years ago, which is crazy. And really, functional medicine is, in my opinion, a new term for what really naturopathic or holistic medicine encompasses. So with functional medicine, we're really looking to figure out what are the underlying factors of disease. Okay, so we're not looking to just find a Band-Aid or medication to mask a symptom, but we're actually looking to try to treat the cause. And that is, of course, then going to be emphasizing looking at lifestyle, spiritual, physical, mental health, genetics, nutrition, and also aesthetic aspects of health. We use a lot of different techniques and testing methods and treatment modalities in this field of medicine. Okay, then we've got regenerative medicine. So regenerative medicine is really exciting because we're harnessing the body's own natural capabilities to heal itself. The body wants to heal itself. And so we are aiming to repair, to restore, and regenerate damaged tissues and organ systems. And often this is by using things like stem cells, tissue engineering, biocues, scaffolding, etc. So as I kind of mentioned in the beginning, in my practice, I have merged functional medicine with regenerative aesthetics. And in my opinion, doing this has been, it's been very synergetic. I started out with the intention of focusing on hormones and diseases of aging, did a fellowship in anti-aging and regenerative medicine. And within, I'd say, 6 months into practice, as I'm balancing women's hormones, they were asking me, well, what can you do for my skin? What can you do for my hair? And when you've put all of this work and investment into helping to balance hormones and clean up nutrition, get detox working, all of these things, the last thing that you want to do is cause harm with endocrine disrupting treatments or procedures, that are putting too much stress on the body. So the way that I practice, I do a very in-depth intake with the patient. I really get to know them, which includes a physical exam, history taking, going over genetics, a lot of advanced biochemistry testing. So I highlighted just a few of the key ones that I like to look at, which includes IGF-1. Has anybody heard of that one? That's measuring essentially growth hormone. Growth hormone, as you may or may not know, that's peaking, of course, about to the age of 18. And by the time we're 30, it's actually decreasing about 3% every year. So that means that we're just not healing and regenerating and restoring the way that we once did. So that's an important one to look at because there are things we can do now to help enhance our growth hormone. I also like to look, of course, at insulin, cardiovascular markers, sex hormones, many other things. Physical exam. So I feel like this is kind of a neat way that aesthetics pivots into this. When I'm looking at a patient and I see, say, a lot of skin laxity, a hollow face, I might be thinking about their cortisol levels. Do they have insufficiency there? If we see melasma, I'm thinking hormone imbalances. We can help catch cancer early, all these things. So you can kind of see how functional medicine and regenerative aesthetics can pair nicely together. And really my goal is to come up with a personalized treatment plan that also includes aesthetic medicine. Okay, so let's get into some of the trends in regenerative aesthetics that we're seeing right now. So weight loss medications. I think everybody's been hearing about the GLP-1 agonist, which I'm going to talk about much more in depth later today. But this has been huge, really groundbreaking in the development of medical weight loss. So as more medications have been getting approved and used, we're also seeing more side effects. Some of those include loose skin, sagging skin, I loved this term, Ozempic butt. Ozempic butt. I've actually seen this. And basically what that is a side effect of is that if someone loses weight rapidly and they haven't been maintaining and hopefully even growing their muscle mass, their lean muscle mass, their basal metabolic rate ends up kind of being at the floor at the end of all of this, because not only have they lost fat, but they've lost a lot of healthy muscle. So you get kind of this flat, saggy appearance. So then, of course, these patients are like, well, what can I do? You know, my face is saggy, my arms are saggy, my butt's gone away. So this is a good opportunity to help them out with regenerative aesthetics, which can include things like radiofrequency skin tightening, you know, PRF, helping them with nutrition and hormones too is important. Exosomes. So who's heard of exosomes? Who uses exosomes? Cool, wonderful. So they're basically vesicles that are from stem cells, and they're essentially messengers. They're signaling, and they're carrying nucleic acids, proteins, lipids, peptides, and I really love to use them these days to help people in their post-care. I find that, you know, they heal much faster after a fractional treatment or IPL. You can use them after threads. I know in Europe they're already injecting them, and I think some doctors in North America are experimenting with that too, although typically they're being used topically. Tweakments. So this was a term that has come up more recently, and essentially, it's kind of cute, kind of endearing. It's essentially referring to kind of minimally invasive procedures. So there seems to be more of a trend in doing these lower downtime, less invasive treatments. The Gen Z population definitely, I'd say, is kind of helping to spearhead this effort. And examples of tweakments could be, you know, going and getting a wonderful electrocurrent facial. It could be body contouring. It could be biostimulation. So many different options. And then I love this one. So another trend is the ability to treat all skin tones. So many, many years ago, maybe it was sort of like nice to be able to have something that could address all skin tones. Whereas now we have technology that can treat all 6 Fitzpatrick skin tones. And I feel like Sinclair Viora was ahead of this. I know when I got my V20 IPL many, many years ago, one of the things that stood out is that it has filters that was able to treat all skin tones for laser hair removal, IPLs, etc. So this is, you know, a big thing that hopefully everybody is able to offer. And this is just kind of showing different settings of our system. Hair restoration. So another huge trend in regenerative aesthetics. I started doing PRP hair restoration over 10 years ago. I've had really good success with that. Those are a couple of my patients there with before and afters. Typically I'll start with a series of 3 treatments spaced 1 month apart. And on average, studies would show that you're getting about a 50% increase in hair follicle growth after 3 months. I love PRP. I've had amazing results with PRP. The downside, I would say, is that it can be kind of painful. It's stinging. And if your patient isn't in good health, meaning, you know, their platelet count isn't great, they don't have as many growth factors in their PRP, their result's not going to be as good. So where I'm going with this is there's some more kind of newer emerging treatments we can do for hair restoration, which includes topical exosomes and also electrocurrent. So in the last year, I've been integrating use of my Dermafuse to basically infuse an exosome hair restoration product into the scalp. And this has helped to level the playing field for folks that, you know, either they can't do PRP, they don't want to have a blood draw, they don't have good quality PRP. So this is really exciting to me, and it is my understanding, I believe, that Sinclair will be launching some new things with regard to this. So, yes. just wanted to kind of show you the Dermafuse. So I've got this in my practice, so I've been actually infusing serums, specifically exosomes, into the scalp to help regenerate hair. And so essentially it's creating kind of an opening, a little micropore opening to deeply infuse whatever type of serum or product that you're using, growth factors, nutrition, et cetera. And those little microchannels are open for a small amount of time, and then they reseal. And the nice thing is this doesn't hurt your patient. There's no poking, there's no blood draw involved. You can train other people, and your staff to do it. So I'm really excited about this development. And yes, you can do it on the face, body, and scalp. So that's just a picture if you haven't seen the Dermafuse before. Vaginal rejuvenation. So this may be on your radar, it may not be on your radar. I'll be talking about this more in depth tomorrow. Personally, I was so excited when I found out a few years back that we had this new device, the VVR, because I see so many complaints in my practice because I see a lot of women in the perimenopausal and menopausal phase of life. And the cool thing is the market is really growing in this area of medicine. So vulvovaginal RF therapy can help address stress urinary incontinence, laxity, dryness. It helps with your sexual response as well. It doesn't have any pain or downtime. And I know the Asian market currently is largest for this, but North America is really picking up. And again, I'll go over the details of that more in one of my other talks. In kind of putting things all together, in my practice, I really like to pair the radiofrequency VVR treatments alongside of the O and G shot, depending on what's going on. But they have a really nice synergy, and we've seen some great results with that. So obviously you've heard me referring to radiofrequency because this is one of the trends in regenerative aesthetics, and many of you are probably already familiar with it. But essentially what we're talking about here is the radiofrequency is a non-ionizing form of electromagnetic energy. And essentially when it is delivered, it's causing the cells to oscillate, to bounce around, to get active. And the mitochondria, the energy-making portion of the cell, is upregulated. So all of this to say, we're getting, collagen regeneration, elastin regeneration, increased blood flow, cell communication, and beautiful results. So this is a picture of the fractional radiofrequency tip. I wanted to show it because I really appreciate how versatile it is. You can treat small and big areas with it. And there's different settings and modes. So if you want to do ablation, for instance, for scarring or a really stubborn pigmented lesion, you can do that. Or you can change it so that you're more so just kind of inducing the collagen and elastin regeneration and not having downtime. So my patients have really appreciated this. So the one to your far right is actually, she's a 43-year-old female patient who I helped lose 90 pounds in a very holistic weight loss program. It did include tirzepatide, or Mounjaro, if you will. And it was the neatest experience to kind of walk her through this and help her regain herself and be able to go skiing and play with her kids. But at the end of it, or partway through rather, she said, Dr. Tacita, I'm wearing things I couldn't wear before, I'm doing things I couldn't do before, but I'm also noticing, this sagging skin, and I feel like my outside isn't matching how I feel on the inside. So one of the things that I did with her was some fractional radiofrequency treatments, and we did a great job of helping to tighten up her skin. You can see she had a pretty bad pigmented lesion that got better. She was a tricky one though, because in between her treatment, she kept like going out in the sun because she was skiing and doing all these things, and I'm like, ah. So we had to do a few extra treatments, but yeah, it was a lot of fun. And then the other lady on the left, she's actually in her 70s, someone who, was very healthy, hadn't done Botox, lasers, anything, and so started off with radiofrequency, and she had a beautiful result, minimally invasive. It didn't feel threatening to her, very low downtime. So all of that to say, to put it together, basically kind of the point I wanted to hit home is that with regenerative aesthetics and I incorporate functional medicine too, you have the ability to be looking at the person as a whole. And we can offer things that not only help patients to look and feel better, but we can incorporate other things like talking about good nutrition and internal health to help their longevity hopefully expand, but also to have a better quality of life. It's not just about, living longer and looking better, but you want to have a good quality of life. So I would just say, to everybody out there, ask yourself some questions. Are you offering regenerative aesthetic options? If so, which ones? Is there anything that you think might be missing in your practice that, is needed to kind of better serve your population? And also just kind of realizing what is going to add more value for your specific set of patients. I think we all can kind of have different little niches and attract different types of patients. So I think it's kind of understanding your patient population and thinking about like, what have they been asking me about? What have they been asking me for? When am I kind of hitting a roadblock, and what can I do to move past that? So I'm excited to hear all the other speakers today and tomorrow. And again, I'll be talking a bit later about weight loss and also vulvovaginal rejuvenation. But are there any questions that anybody wants to go over right now? Everybody's quiet. Okay, well then I'll hand it off for the next speaker. Thank you for your time.